Hi, I'm Dr. Beyer. Welcome to Treatment Success Secret number 7, where we're going to talk about anemias. For those of you who don't know, a lot of people do know what an anemia is, but for those who don't, an anemia is a metabolic condition where the red blood cells cannot effectively pick up and carry oxygen to the tissues. Now, obviously, that's a problem. If you want to know how important oxygen is, just hold your breath for 10 minutes is what I tell patients. And if you're chronically 24/7 not carrying oxygen effectively to the tissues, then that can cause a lot of problems and can be an underlying contributing factor to migraine or severe headaches. Let me give you one example of how that could be true. Our nervous system is about 2 to 3% of our overall body weight, and yet our nervous system consumes 20 or more percent of the oxygen that we consume. So the point is that the nervous system is very highly oxygen dependent, and so even slight diminishment of the body's ability to be able to carry oxygen to the tissues causes severe or significant ramifications neurologically. And with migraine headaches, oftentimes there's some subtle neurological dysfunction where the nervous system's not firing quite right. The neurons aren't firing quite like they should be. The neurons are the brain cells. And a lot of times, one reason why that is so is because there's a metabolic problem, such as an anemia, where the blood's just not carrying oxygen to the brain very effectively. There's a decreased amount of oxygen getting up there. And a lot of anemias are missed because of the lab ranges being very wide and doctors not knowing what the optimal ranges for the red blood cells or the hemoglobin are. Again, you need to work with a doctor who knows functional medicine and can pick up these subtle imbalances metabolically, including these anemias. So give the office a call, 815-469-8500. Schedule an appointment. When you come in, we'll do a functional neurological exam and see if there's some neurological imbalances there. And you can bring in old blood chemistry tests, and I'll take a look at them and evaluate them from a functional standpoint. If you don't have them, that's fine. We can get you to get some blood tests and begin evaluating you metabolically and begin to have you get your life back and get rid of these headaches. 815-469-8500.